To have you back, and there you have it. That is like the summary of Nigeria's health sector in 2022. My name is Reba Misalako, and it is indeed a pleasure to be hosting this program on New Year's Day. And I have with me in the studio Emmanuel Ekole, the National Coordinator, Network on Police Reform in Nigeria, NAPRIN. Many thanks for being with us today.
Thank you for having me.
Yes, and joining us virtually, we have Dr. Madaki David, who is joining us live from Kaduna State. He is the chairman of the Nigerian Medical Association, Kaduna State. Thank you so much for joining us for this time, sir.
Thank you for having me.
Okay, to begin with, I know that we already have a report on how 2022 is for the Nigerian health sector, but from your own view, if you would really summarize it, for the health sector, how has it been 2022, the challenges? And I don't want us to talk about the challenges alone. What about the breakthrough that has happened in the health sector in 2022?
Okay, thank you very much once again for having me. Yes, for 2022, I would say, to be honest, if we were to assess how 2022 had gone, I would say we've not really done well, because if you look at the indices have actually worsened in some areas, and so if we're to be frank and to really give a quick assessment of how 2022 went, it will be below average, and there's so much room for improvement, because you look at some issues that are supposed to have been addressed, more of political than actually technical. So because we look at things like funding, for instance, funding healthcare financing in the health sector. You look at that, you want to see that monies are budgeted, probably they are not released. And then if you look at it also, Nigeria signed the charter to ensure that we raise our budget for healthcare. But what are we at? We hardly exceed 3% over the years. So I don't think we can get anywhere in that with that kind of attitude. So we lack the political will, by and large, to really address some of these challenges. So these are not rocket science, to be honest. So I would say we've not done good in 2022 so far.
Okay, all right. And you mentioned the political part being one of the major problems of the health sector in Nigeria. But now let us talk about the people working there, because one of the things that you would hear people complain of, especially when they have an emergency and they go to the hospital, one of the things they complain most of is bad attitude of some health workers in the hospital, that is in addressing patients and all that. Is there anything that the NMA is doing to ensure that people get quality services, and you don't just go to school to study medicine because it's probably a lucrative course, it's a course that awards you a lot of respect, but because you're doing it because you actually care for people's life? Because what we see in hospitals, you going to hospital to take care of yourself, is not always a pleasant experience when it comes to communicating with these healthcare professionals that we have in the hospital.
Yes, attitude. Yes, some studies have actually shown that poor attitude of healthcare providers are contributory in some aspects. But you look at it, what is the underlying cause? What is the root cause, rather? Let me put it at that. If you have demotivated health workforce, overworked, we've talked about brain drain, people living in droves and what have you. If you have that kind of system, you rather blame the system, because if you look at it, the public sector is there and the private sector is there. Majority of the problem we are facing and seeing is usually in the public sector, and the public sector is such that there are a lot of issues that needs to be addressing from the governance and leadership part of it. Yes, I'll tell you that if you have a poorly motivated health professional, I don't think you would want to take be seen or rather consulted by somebody who is unhappy with the working conditions, with the environment, and what have you, and even for the psychological and mental health of that healthcare professional is an aspect we always leave out. So there are a lot of contributory factors which we really need to pay more attention to details rather than just clogging it up and saying, okay, poor attitude of healthcare workers. Agreed. There are a few exceptions, a few cases like that. But if the whole thing, the system entirely, the healthcare system needs to be rigid. And some of these issues will be addressed when the fundamental things are actually put in place and corrected. So I see it that way, more or less, because most of the times you go to a private sector, and to be honest, I think the private sectors, which is even responsible for seeing 60% of the population, has not done badly. But of course, you have issues of affordability and costs, high costs, because these proprietors of the private hospitals themselves are not even being supported. There is no investment in it. So how do you survive even in harsh economic realities that we have? And so that is it. So we need to start looking at other areas in how to now probably come into bringing a public-private partnership or things like that that could help to support the system. Because leaving these things to government alone, well, I don't know, because most of the times you get into agreements, you sign agreements on certain, whether it's remunerations, whether it's improvement of facilities and what have you, and the government most of the times reneges on their decision. We have situations where in Kaduna, for instance, the state doctors are poorly paid compared to their federal counterparts, and then they're overworked in the general hospitals across the state. It's alarming, the number of ratio, doctor to patient ratio. WHO actually stipulates 1 to 600, but in Nigeria, depending on even the area, it's as high as 1 to 10,000. So you can imagine that somebody who is overworked, you have to do calls, you wake up the next day, you have to also come and see patients and continue work, and these are things that actually needs to be addressed. And these are the advocacy that NME has tried to engage government politically. Let the political actors actually live up to their responsibility as well.
All right, thank you for that. And seeing that from Kaduna State, from January 2022 to December 2022, Kaduna State have been in the news always for insurgency, banditry, kidnapping, and all that. And one could only imagine the surge of people that would be going to the hospital, maybe for cuts, for gunshot wounds, and all that. So, how has the state been able to manage the health sector, particularly in the area of insecurity, when insecurity is really ravaging the state?
Yes, you look at the issue of insecurity is actually a big problem, and mostly affected is the rural areas where we don't even have doctors willing to even be there because of the insecurity. Because as I've said in the past, and I'm always saying that healthcare workers are even targets for some of these insurgents, and for kidnappings, whether it's banditry and what have you. And these areas where the insecurity there's a high level of insecurity, even traveling to those areas is a risk. So already we're stretched. Already you have few number of doctors in such areas, and then the few themselves have had to migrate, have had to move, either by resigning or leaving the country or what have you, to look for greener pastures. First and foremost, they're poorly paid. Secondly, you're not feeling secured in the place where you are. So these are challenges really that are of concern, and that's why I had called for a declaration of a state of emergency, because if you look at the push factors, really, insurgency and insecurity generally is one of it. So in coming down to dealing with the casualties, really, well, I think basically some of the casualties that have come in some of those areas, they have to move them to closer hospitals, bigger hospitals in neighboring local governments where they can cater for such people. We've seen a few, like in the last attack that happened in Kagoro, in Kaura local government, where about 30 plus people were killed. Some of the casualties had to be moved across to a neighboring state, closer to Plateau State, which is a neighboring state to Kaura local government. And some were taken to the general hospital in Kafanchan, that's the Sir Patrick Ibrahim Yakowa Memorial Hospital. So by and large, sometimes you receive this kind of cases, and then even the basic tools sometimes to intervene, it's a problem, because and that's why we keep saying that the political will is not there, because funding is an issue. Sometimes when you complain, they'll tell you, well, the administrators will also tell you that the overhead is not regular to service these hospitals. So these are real life issues that were challenges really we're going through. And Kaduna State is not just the only one. Across the other northern states, you go down to Zamfara, you go to
Would you
Katsina, they're
advocate
facing
for
similar things.
ending medical tourism? Would you advocate for ending medical tourism? Then perhaps if that is done, then the politicians or the leaders' attention would be on Nigeria's healthcare system. What do you have to say about that? Ending of medical tourism.
Yes, I keep talking about the political will, and I'll still go back to that. Medical tourism, really, you look at why do people engage in medical tourism? Basically, the system is faulty. There is a problem, that no confidence rather in the system. Those who can afford move out into other countries where you still have the same Nigerian doctors or Nigerian healthcare professionals working, and actually the Nigerian doctors are the best across in the world. If you look at it, they're doing wonders across the world. So coming back home, we tend to wonder, what is the problem? And that is why we keep reiterating the fact that there needs to be a discussion on our health system. It needs to be in the front burner. Now we're in a political era. We're not hearing those discussions. We're not hearing people discussing what plans they have on stopping things like medical tourism. The other time there was a plan for, somebody raised an issue in the National Assembly, I think, talking about ending medical tourism, and the proposal was rejected because the people that are actually beneficiaries are still the political class, because they still go abroad on the budget, on the finances financed by the Nigerian government. So you see, the thing has to take a political approach. I think healthcare is more of political than technical right now. And that is what we need to do. We need to engage our political leaders. We need to hold them accountable. We need to let them have plans and a roadmap for the health system on how to get us out of the mess we're currently in.
Thank you very much. We'll still come back to you, but now let me ask Mr. Emmanuel, looking from the outside now, how would you rate the Nigerian healthcare sector for 2022?
Just like my brother has been saying, there's a lot to be done, and 2022, just like other years before now, especially during 2020 when we had the COVID, moving to the time of the NSAS, there were a lot of cases that demanded emergencies, especially as it relates to health. And the way the country handled it, you will notice that there have been a lot of gaps that need addressing, and nothing has been done. We spoke about COVID briefly, and emergencies were done here and there. And then after then, I think early last year again, We heard about the second phase of COVID, and then there were little emergencies and it ended at that level. Other sectors or other countries worked on how to improve their own health sector to make it workable, to address concerns that comes up in this type of emergencies. But Nigeria as a country just don't want it to work, because we are so unfortunate with the quality of leaders that we have. So they are so selfish in trying to work for them, not for the people that voted them to occupy those offices. And that has been causing a lot of issues for the health sector. We have been losing a lot of Nigerians, and that is because we don't have the facilities, we don't have the equipment, and even for the few lawyers that we have, not all of them have certain expertise in certain areas. We have maybe a lot of lawyers in a particular area, but very few in certain areas. So when there's a need for such places, then you are looking for who to reach out to. And the fee they demand again at that point again is most times above the means of those persons that need those help in those particular needs, and that has resulted in a lot of persons dying. People in rural areas, when they have emergencies, the primary health care centers in those areas most times are not working, or maybe the doctors are not available. Most of doctors, I know many doctors that they are working for the government, but went back to build their own hospitals in rural areas. Now they get some facilities or some equipment from the government hospital to go and put their own hospitals. So if persons come to a treatment, they refer them to their own personal hospital, go there and treat you and then collect money at that level. So just like our brother was saying, the inadequacy is inherent with the system, the political class failing and not even wanting to improve the sector. If we check about the budgetary allocations for health, it's usually much. But when it comes to the money actually reflecting on the facilities or the quality of tools that the doctors need in those places, you don't see them. That means the money goes somewhere. There have been no checks. So it's pertinent that actors, particularly CSOs that are working in health, they should pay close attention and check these excesses and actually flag it up, so that those persons, those culprits can actually be brought to book. And it's also calling on the criminal justice sector for them to pay close attention, no matter how high those persons are. If they can be checked, it will help. For the medical tourism, it's unfortunate that we, just like I said, we don't have leaders that care about people. We have IDPs in different states. There are certain states that are like hub now of displacement. We have Benue State, we have Cross River. They have IDPs, they have refugees in these areas. But what is the quality of medical facilities in these areas? You go to the IDP camp. I was fortunate enough to have worked in Benue IDP. In short, I was the first person to allocate people to rooms in IDP camp in Benue State, Daudu shelter. If you go there till date, yes, they have been here and there, you have outreaches and all that, but they are not stable people on the ground. When these people get sick, I know many persons died, children, infants died. I was working there, we were managing the camp before we handed over to SEMI. So these are things I know actually. Young persons dying, people get infected because IDPs are trying to see how they can earn a living. So a lot of them resort to selling themselves to raise money. And most times they do this without protection and all that. People take advantage of them also for them to earn a living. At the end of the day, a lot of them get pregnant. A lot of them get infection. A lot of them get sick. There are nothing available to treat them. And nobody cares. The government doesn't care. So once in a while, people go there and do their own help. Once in a while, MSF, Medicine Sans Frontiers, and other CSOs, Alexia Trust Foundation, other CSOs that are working in that area, they go around and pay advocacy visit, go for malaria, give them nets and all that. But it goes more than this. There's a statutory allocation, budgetary allocation for health. Why can't it be used for the needs being made in the first place.
Yes, I'm talking about this. Let's quickly consult Dr. Madaki on this. What do you have to say about sharp practices by some medical practitioners? Because I have heard of cases where one would go to the hospital. There are lots of people who wants to see the doctor, and then you hear of one particular doctor charging like 20,000 naira for them to attend to you. Is that a part of the problems that we face in Nigeria's health sector?
Yes, thank you. I think the health sector itself is not immune to the general corruption that is in the system in Nigeria, actually, to be honest. And if you look at us, the professional body, NME, we have always been admonishing our members to actually live up to the rules of engagement. I mean, to follow the procedures, the ethics of the profession. I mean, if you are in the public sector, you have to dedicate yourself to the public sector. If you must be engaged in any private practice, it has to be outside the hours of the working hours of the public sector. So there has to be that clarity. We do not condone doctors who would actually err and want to shortchange the system, because it also tells in the quality of the service you end up giving at the end of the day. But all these insecurities are things that add up and affect the whole system. So we always try to tell our members not to engage in such. But you find some cases here and there of that. And then, but the medical directors at the hospital level are charged with that responsibility to ensure that such things do not happen. And sometimes when these things happen, it's sad, really. But these are things that must stop. But again, that's why we talk about accountability. The system has to be set up in such a way that there has to be accountability for working hours. People have to be taken up on their work schedules. Let everybody knows what he's supposed to do and when. And that is why we're talking about rejigging the system entirely. We need to start the conversation of looking at probably a PPP situation in the health sector, because government alone is not doing well so far, as far as I'm concerned. And then, I don't know, these are some of the things we see. And unfortunately, you look at it that the public doctor sometimes looks at it that, okay, I'm working in the public sector. If I'm to focus majorly on the public sector, cannot make ends meet. So sometimes these are some of the things that tempt them away from getting into such practices, and which is not right anyway. So but the economic realities in the country is there, and then you have the purchasing powers on what you have, and then the inflation itself is skyrocketing and salaries still remain the same. You find out that among the states, the state governments, the state governors generally across the state, with the exception of a few, have not really been doing well. The majority of the problems we have with welfare of doctors are even worse with states. We have a salary scale, which is the commerce salary scale, but so many states have not actually domesticated that, have not implemented that. They keep, some are doing as poor as below 60%. Kaduna State is part of that. The doctors in Kaduna State received only 59% of the approved recommended salary scale. So these things are intertwined. You have a lot of factors, and then underlying causes and all that. So these things, and that's why I have always said and keep saying that we need to actually start making these discussions, bring them to the front burner, and make them our political leaders accountable, and even the administrators generally, because you need to have
engaged in sharp practices.
Yes, we need to have people who will be sanctioned. We have the Medical and Dental Council of Nigeria, which regulates the professions, I mean the practice of medical doctors. When they are found erring, they are taken to such and they can be tried. And we've had doctors where they have, because of malpractice or sharp practices or issues of ethics, have been tried and convicted. So these things are actually within what we can actually address.
Right, thank you so much for being part of Firecrackers today. I would have loved to engage you more and more, but we do not have time on our side and we have to go on to our next topic. Thank you so much, Dr. Madaki David Cheney, the NMA Chairman, Kaduna State, who joined us live from Kaduna State. Thank you so much. Happy New Year. May glorious year be yours.
Thank you.